All right, so today we're talking about fraud and compliance. The first thing we need to recognize is that you have to assign a compliance officer. Now, this is a person who's in charge of keeping the compliance plan and keeping all the files and folders and all the employees, making sure that any infractions are in those files, as well as the fact that they have reviewed and that they fully understand what the compliance plan is, and they have signed acknowledging that they have read and understand all the points of the compliance plan. The compliance officer is also in charge of making sure that there is a box so that if there's anything that the employees feel is not being done properly, they can report it, self-report, without any risk of being levied against by the doctor, the owner, or anyone else in the practice as far as a penalty. In other words, if they find something that they think is wrong, they report it to the compliance officer. The compliance officer's job is to then make sure that they have investigated that claim and they have found out if it is something that needs to be handled or not. And then they report it back to that person. And if it's something that needs to be handled, that they then pursue and fix the problem that's found. The other thing that a compliance officer should make sure that they do is that they have an open communication line with all of the employees. That means that there's an open door policy for them to come in and discuss any points or issues that they may be having. That all of those points are recorded and kept in a file. The compliance officer can be the owner of the practice, but of course that would not be the best person. It should be an office manager or someone who has been with the doctor, and you expect them to stay with the practice so that they can maintain that position. You should also make sure that there is a signed document that the compliance officer states that they understand that that is the role they're taking on and that that's an active part of your compliance plan. Now, when you keep a compliance plan, you do have to make sure that you follow all the points as laid out by the OIG, that's the Office of Inspector General's office, and it's important that you do understand those points. Now, it's kind of difficult to understand 2,000 or 3,000 pages put out by the federal government, yet alone 25,000. But the point is that if you use an attorney or a certified coder and biller to help you understand what a compliance plan is and to make sure that you fully have it implemented, it is an ounce of prevention that's worth its weight in gold. I want to thank you for paying attention and encourage you to, again, make sure that you do have an active compliance plan.